so good to switch from Zoom to schmooze. So I knew this crowd would appreciate that joke. So mental health and healthcare are in fact the only, I think, some prime features of our Declaration of Independence. Life, liberty, and the pursuit of happiness. Happiness is, of course, a mental health goal. Happiness, joy, love, well-being, all of these things. And also a psychoanalyst pointed out that our Declaration of Independence was in itself a rebellion against tyranny. So that tyranny becomes a mental health issue and a populational and social well-being issue. So very important at this time, of course. I think the Declaration of Independence could maybe be reread as a declaration of interdependence, because we are all connected deeply, and we sometimes we can't see the connections; they're not visible. So we can lose that palpable sense of continuity of human to human and heart to heart. I practice, I'm a psychiatrist, I practice mostly from a position of relational cultural theory, which is developed out of feminist theory, which is the prime insight is suffering is a crisis in connection. And disconnection is the opposite of, suffering is the opposite of disconnection. And the opposite of suffering is belonging. So creating belonging is a mental health goal for me and for all of us. And I think that, in terms of disconnections, I think the whole idea of peer-to-peer counseling is very much based in connection. We are all peers, we're all equal. I mean, that's what we're striving for, a condition of true egalitarianism throughout society, I think. And that would relieve so much stress and burden on marginalized, minoritized peoples, which causes additional stress and has impact on mental and physical health as well. And so they're very concrete outcomes of power differentials. So remembering that we're all peers, I think, is very important. Unfortunately, people who go through mental health crises, I've often said, very few patients in psychiatric inpatient wards get flowers, okay, or visitors. And prisoners, do not get flowers and visitors typically. And so there's this palpable disconnection that happens when someone goes through a mental health crisis, a social health crisis, and this, reverberates around society. And Freud said that the unconscious can only be known when it is named and brought into consciousness. And what I say is that what we're most unconscious of is our relatedness. And so this event helps us bring our relatedness into consciousness, because otherwise our distresses communicate without our awareness or consent. We don't know how they'll travel their way through society. So dealing with suffering is a monumental task, and it requires all of us to cultivate compassion, relationship, and reason. So I thank you for this opportunity.
Qualified for saying that I was a math major, and so I'm always about the statistics, but not always. I mean, I know that there these anecdotal and the practitioners like yourselves in the field really bring, obviously, a lot of knowledge, but just to set the stage where that question came from.
Sure, I actually haven't studied the evidence base for peer-to-peer, but there is, because there are programs, and they couldn't have programs without there being an evidence base. So I'm sure it's there, but I would say, having relatedness from someone who gets it, someone who understands, is so important. And as you said, to keep people in the system, or to have them form an attachment to a group of providers, which includes peer counselors, is so important. The common factors of any therapeutic relationship, compassion, empathy, warmth, positive positive regard. I mean, those can be cultivated. I mean, everybody could learn those things, and amplifying those things is probably one of the greatest treatment modalities, underutilized treatment modalities out there. The relationship is the bulk of what heals in any therapeutic relationship, not the medication, not the intervention or whatever, not the therapeutic technique, but the building the relationship based on those common factors. Yeah.
Can you maybe leap off of that point and talk a little bit about how you've seen, maybe more in detail, how you've seen the stigma around seeking care breaking down either over time as maybe society becomes more comfortable with it or not, and just talk a little bit about the stigma and Laura, and anyone else but you to weigh in as well.
Sure. I guess we all know about stigma of people who go through mental health crises, and that this is something. There's always bias in any system, especially around power. So who is seen as understandable by any given eye, so to speak, that can produce either compassion or bias and stigma. And I think living in the blind spot of a culture is so difficult for anyone with any kind of either identity difference or mental health issue. It's so difficult. In that space, in that blind spot, in that emptiness, we have to create mind and create community, because there is none. The mind is kind of evacuated from those areas that these people occupy. And so that's part of what I do as a psychiatrist now, helping with my patients, collaborating to fill in a hole made in time through our travel through biases and stigma and power relationships and all of this. We have to remake that with humanity. So.